Of major importance in the management of a patient who presents with lower back and lower extremity pain syndromes is to restore functional balance to the muscles of the lower extremity, particularly the muscles governing the 6 movements in and around the hip joint. You want symmetry of length, symmetry of strength, and proprioceptive balance. Now, to test for length and strength, there are a number of different systems available to you. Let me demonstrate for you a simple one that I've found effective over a number of years. This is not a purist sense of each muscle that we're going to test, but the mass action of all of these major muscles of the hip and thigh that are involved in gait and the relationship of the lower extremities to the pelvis and the lumbar spine. We will begin by having Mark lie flat on the table with the head at that end for me. And what we're going to do is to evaluate range of motion of 6 different ranges of motion in and around the hip joint. And we're going to look both for its length and for the strength of the muscle group that contributes to that motion. The first we will start with will be the motion of abduction, and we're looking for symmetry or lack of same of abduction movement right to left. Now, if we have asymmetrical range, we can have 2 different causes of that. For example, if we have less abduction on the right than we have on the left, that could be due to 2 different reasons. One is the restriction of the right side might be because of tightness of the right adductor muscles, or we have greater range on this side because of weakness of the adductor muscles on the left side. To differentiate then, what we would do would be to ask the muscle to contract against resistance and measure its strength. Pull a leg in, pull. That's relatively strong. Relax. Now let's test this one. Pull in again, pull. Relax. Mark tests out fairly equal in his strength on either side. But let us simulate a treatment for both shortness and tightness as well as for weakness, because the principles are somewhat different. If we had found that there's restriction of abduction on the right side due to tightness on this side with equal strength, what we want to do is to perform a muscle energy contraction of these adductor muscles, and then post-isometrically we will want to stretch them out. Just slide to the right just a little bit, that's fine. Principle will then to keep the knee in full extension, to stabilize the knee and close back. Do not let the foot externally rotate either during the diagnostic or the treatment process. Notice, if you will, if I let it externally rotate, I can get a lot of abduction. You keep it perpendicular, that's the true range of abduction at the thigh here. So we're going to treat this by post-isometric relaxation. Knee straight, stabilize the opposite side, slide my leg in medial to the knee. At the barrier, I'm going to say, Mark, pull your whole leg toward the middle. Pull. An isometric contraction of the right adductors, stop, relax, and then stretch. Pull again, and relax. 3 to 5 efforts again of isometric contraction, a post-isometric relaxation stretch, should enhance the range of motion of abduction on this side. Had we found that there was greater range on this side, the left side, because of weakness of this group, we would want to strengthen these adductor muscles by a series of concentric isotonic contractions. And let us simulate what that would look like. Again, stabilize the knee in full extension. Do not let the leg externally rotate. take it to full range of abduction, and ask him now, pull the foot toward the middle. Pull it in, activating the adductors. Give resistance to it. Keep going, full range, and relax. Take it out to the full range of abduction. Pull again. This time I offer more resistance, making the left adductor muscles work harder. Keep coming, Mark. Keep coming. Full range. Stop. One last time. Pull with, again, more resistance. Make that muscle work harder each time, but do it through the full range. To test if you have been effective for the shortness, you would expect normal range. If you would then increase the strength of this side, when you strength tested it, it should be symmetrical with the opposite. Those principles of either stretching the tightness or strengthening the weakness are applied to all of the other movements in and around the hip and the thigh. The next movement to look at would be adduction movement, to test for the length and strength of the abductor muscles on the side. We're going to test the adduction movement of his left side for range, quality of end feel. Range, quality of end feel. If we find tightness of the abductor muscles on this left side, we would go to the barrier of adduction motion, push the left leg out. Mark, push, make it contract isometrically, stop, stretch, push again, push, stop, stretch. This leg that I'm holding on the right side is just stabilizing his pelvis as we work his left leg. Push it again, push, relax. If we wanted to strengthen the abductors on this left side, we would take it to adduction and tell him to push the leg out to the side. Go, 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 go. Full range. Stop. Do it again, this time with more resistance. Keep going. Full range. Stop. And again. More resistance, we make it work harder each time. So we would restore balance of the abductor muscles with their length and strength. The next muscle we would look at would be hamstring length. Now, straight leg raising includes more than hamstring length, but to monitor the length of a hamstring, we put our fingers on the opposite anterior superior iliac spine, flex the extended leg until we first feel the pelvis move underneath my hands on the right anterior superior iliac spine. That is actually the hamstring length. Switch hands and compare the opposite side. If we find restriction of straight leg raising due to hamstring length, and we wanted to stretch a hamstring, and you will many more times want to stretch hamstring than strengthen them, but to stretch the hamstring, we would do it in the following fashion. Put the heel on my shoulder. I'm going to control hip flexion and knee extension till we get to the barrier to the hamstring. Now, Mark, pull your heel down to your buttock on the right side. Pull it straight down. And stop. Following isometric contraction. Stretch it a little more. Pull down. Pull. Relax. Get to the barrier. Pull down one more time. Relax. And then stretch the hamstring out. And then go back and retest again. The next group will be that of internal and external rotation at the hip in the 90-90 position. We have 90 degrees of knee flexion, 90 degrees of hip flexion, and in that position we're going to test the capacity of external rotation and internal rotation, movement, range, quality, and end feel. Now, internal rotation of the femur in this 90-90 position puts the piriformis on stretch. That is the piriformis length. Very important muscle in patients with low back and lower extremity pain syndromes. Come to the opposite side, internal, external rotation. This is internal rotation of the hip. The anterior surface is turning medially, internal rotation, and external rotation. Now, the one that you'll treat the most of this group will be tightness of a piriformis. And the way you would do that would be to assume this same 90-90 found restriction of internal rotation. So you want to maintain that. Put a little adduction movement in. That puts both the adductor and external rotation function of the piriformis on tension. And then the resistance would be in the following way. Post-isometric relaxation is our principle here. Pull the foot toward the middle, Mark. Pull it in. That's external rotation. Resist that. Stop. That's one of the functions of the piriformis, external rotation. Pull again. Stop. The other function is abduction function, and we have him do that by push the knee toward me. Now, Mark, push. Relax. Actually, you get a little bit of each of those abduction and external rotation with each effort. But do a little of both, whichever seems to work the best, and always stretch after each activity. Had we wanted to strengthen that piriformis, we would start here, push the foot out toward me. Push. Keep going, keep going, keep going, all the way. Stop. Push again. More resistance. Keep going all the way. And all the way. The internal rotators are seldom in need of treatment in that position. Having done abductors, adductors, hamstring, and internal and external rotation in the 90-90 position, we'll now ask Mark to roll over on his stomach. And now we are going to test for quadriceps length. This one we can do simultaneously. Flex the knees, both hands symmetrical, and the one that goes the farthest is what you're looking for. In Mark's instance, we've got tightness of the left quadriceps. Now, to make sure that this isn't due to weakness of this right, I'm going to ask him, straighten out your knees, Mark, push. And that feels symmetrical to me. So he has symmetry of his length, of his strength rather, symmetry of his strength. So I know I have tightness of the left side. To treat that then, I must resist knee extension, quadriceps action. Put the foot on my shoulder, hold the table. This is a very powerful muscle, and you have to put a lot of resistance against it in order to accomplish your task. Straighten out your left leg, Mark. Push. Relax. More knee flexion. Push. Relax. And one more time. Push. Relax. And stretch. We should then get symmetry of knee flexion as an outcome. Had our abnormality been weakness of this right quadriceps, all I would have done was say, all right, straighten out your leg. Keep going. Go, 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 go. Full knee. Go. Straight. Good. Let me have it again. More resistance, second effort. Go, 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 go. And relax. Again, 3 to 5 reps of full range. Again, go, 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 go. Recruits more firing within the muscle, strengthens the muscle physiologically. In this position, we then test internal and external rotation in neutral for the hip joints. So that would be internal rotation. And then to test external rotation, we stabilize one side, test this one. The first movement of the pelvis is due to external rotation at that hip. Stabilize this side. Now this internal rotation maneuver tests the other 5 external rotators of the hip joint, other than the piriformis, which is the 6th one. Have we had restriction of that on, let's say, this right side, we would treat that by having him push his foot toward the middle. Push toward me, Mark. And stop. That's an external rotation effort that we are asking the external rotators, obturator internus, externus, commendus superior and inferior, and the quadratus femoris, to push the knee toward, push the foot toward me. Push toward me. And stop. Always going to the new internal rotation barrier and push again. Relax. Same principle will be applied if we had found resistance to external rotation. We would stabilize here, push the foot out toward me this time. Resist, post-isometric relaxation, stop. One more time, push, stop. So now we have done the abductors, adductors, internal, external rotators, both in the 90-90 and in the neutral position. We've done hamstrings and quadriceps. The last muscle we would now test would be the psoas. If you'll roll over on your back for me and slide down to the end of the table for me, Mark. All the way down, all the way down. Now, take and hold your left knee. Bend it up and hold your knee. And let me take you back down to the table. Lie back. Now, you never want to test this muscle until you're sure you have pretty good lumbar function, because you can put the lumbar spine into considerable stress doing this maneuver. What we want to test for is the length of the psoas, and we will do that now. He's flexed up his left leg, holding the pelvis tightly that way. We now passively extend, and what we're looking for is the capacity of this leg to extend sufficiently to get the back of the thigh to the table. If it doesn't get to the table, then we have shortness of the psoas on this right side. To test the other one, we'll just have Mark change his hands, keep the right knee tight, and then let me take the left one down, and we do the same procedure. Now, let us suppose that we had found shortness of this right psoas. Hold the other knee. How we would treat that would be as follows. We'd ask Mark to stabilize the pelvis by keeping the non-symptomatic leg fully flexed. I would passively extend it down to the first extension barrier, stabilize the leg, in fact put a little internal rotation to it, and then resist. Lift the right knee to the ceiling, Mark. Lift, stop, then I would stretch it down. It's important that he maintain this all the time. Lift that right knee again, right knee up, and relax. A little icing on the cake is, as you lift it this time, pull the foot toward the middle. The right foot, that's good. And relax. Once we have tested for and evaluated length and strength, treated them symmetrically, both sides, with whatever is appropriate, either a multiple repetitions of isotonic contraction for a weak muscle or a series of post-isometric stretches, whichever is appropriate for each of those groups of muscles. But you want to make sure that you have restored symmetry as best you can, so that the muscle imbalance doesn't cause your dysfunction within the pelvic girdle lumbar spine, and the rest of the trunk to recur because of that abnormal muscle activity.